As Pride celebrations continue around the country, one often overlooked sector of the community is the elderly.
And aging comes with a wide range of concerns, both financial and physical, and older LGBTQ+ individuals have specific challenges.
Karen KUSA joins us this afternoon with some tips on how medical professionals can improve. Good afternoon, Karen.
Good afternoon, Sam and Alex. Elder care is expensive and challenging and confusing to navigate for a lot of Americans, but experts say especially within the LGBTQ+ community. Pride Month has been full of celebrations, but it's also a good time to draw attention to some unique concerns.
It's a rapidly growing population with a unique set of challenges.
There are over 3 million LGBTQ older adults in this country, and we're estimating that is probably going to grow to over 7 million by 2030.
According to the American Association of Retired Persons Dignity 2024 survey, the largest concern for older LGBTQ+ adults is social isolation, which could mean lacking the support they will need as they age.
The LGBTQ community is more likely to be single, less likely to have children, and some of those social connections that we would assume from a family or biological connection aren't there.
The survey also found a number of queer adults feel vulnerable in healthcare spaces, particularly trans and non-binary people, with a third saying their quality of care has been compromised.
Anytime you find a new doctor, you have to come out again. And it's a challenge sometimes to find good healthcare professionals who understand all the needs of the community.
Ernesto Finales with the nonprofit advocacy group SAGE says medical providers should take time to understand where these patients are coming from.
I think part of that is really connecting with the community and making sure that their voices are elevated.
And for members of the community looking to take control of their future,
it really is a matter of planning, not only in terms of caregiving and who is able to care for you as you age, but also making those financial decisions so that you're prepared to make the decisions that you want.
And the nonprofit advocacy group SAGE also says that many LGBTQ seniors experience discrimination during their careers and their earning years, diminishing the funds they have now for retirement and care. Sam and Alex?
A question. The House-passed version of President Trump's massive tax and spending bill proposes deep cuts to Medicaid. How do you expect the experts there, and would those cuts, would they impact elder care overall, specifically more marginalized communities?
Yeah, well, certainly this is something that is coming into focus as Senate Republicans debate their version of the bill. And the Medicaid cuts are a point of contention with some Senate Republicans. But Republicans who shaped the bill in the House see deep Medicaid cuts as offsetting the extension of President Trump's 2017 tax cuts. But when it comes to those Medicaid cuts, this could be elder care across the board being impacted because Medicaid covers more than 60% of residents in nursing homes. States are required to cover them as long as they are 21 and older. There's not direct cuts specified in the legislation, but what the concern among advocates for elderly and healthcare is that the states encounter gaps in their federal funding and they in turn start to cut their own programs, right? So some of the things that could potentially be targeted would be decisions about assisted living coverage, about reimbursements offered to some home and community-based caregivers. So many in the healthcare community really eyeing this legislation very closely to see what happens with those Medicaid cuts.
Okay, Karen KUSA, nice to have you with us live this afternoon. Thank you.